everyone! Good morning! First of all, let me introduce myself. My name is Ayesha Humayra Fayyaza, and I'm from Senior High School number 17, Palembang City. And today, I'm gonna explain the topic about encouraging public awareness of the prevention and control of metabolic and endocrine disease. Metabolic disease is a medical disorder that affects energy production in the cell of the human body and generally caused by genetic disorder so that enzymes that play a role in some metabolism process are lost or damaged. And various toxic substances in the body accumulate in the bloodstream because they fail to be removed. However, this disease can also be caused by food, toxin, and infection. While endocrine disease associated with the endocrine glands in the body and that produce hormone in the form of chemical signals that are released through the bloodstream, and risk factors for this endocrine disease include elevated cholesterol level and then family history of endocrine disorder, inactivity, history of autoimmune disorder, poor diet, surgery, trauma, infection or serious injury or pregnancy in special cases such as hypothyroidism. In Indonesia alone, the number of patients with diabetes mellitus, especially type 2 of diabetes mellitus in inpatient and outpatient hospital, rank first of all endocrine disease, while type 2 diabetes mellitus itself is a disease caused by unhealthy lifestyle and eating patterns because they cannot control their intake sugar that enters their body. This proves that public knowledge and attention regarding endocrine and metabolic disease is still not sufficient or has not become a concern. In fact, these disorders are chronic diseases that are known as the silent killer. To reduce the rate of cases of metabolic and endocrine disease, of course, require cooperation between the community and the education by the government. To prevent endocrine disease, people can maintain an ideal body weight, consume balanced and healthy, nutritious food, and exercise regularly to maintain body fitness and health, and balance the iodine consumption to prevent thyroid problem. While metabolic disease itself, it's usually an individual since birth, and if symptoms of metabolic disorder have appeared, it can be diagnosed by carrying out routine screening tests or they can have a DNA test. Whereas in endocrine disease, whose emergence can be prevented, we can do this by reducing the intake of food or drugs that the body cannot process normally, removing the toxic substance that the body fails to excrete, and replacing enzyme or chemical that are inactive. While treatment can be done by taking enzyme replacement supplement or doing a special diet that eliminates certain types of nutrients that cannot be absorbed properly by the body. Based on the regulation of the Minister of Health of Indonesia number 17 of 2015, government will protect the community from risk and improve the quality of life and reduce the impact of non-communicable disease and provide the legal certainty in the implementation of non-communicable disease, and including endocrine and metabolic disease. Therefore, with community cooperation as well as education and health promotion from the government, it is hoped that Indonesia will succeed in reducing the rate of endocrine and metabolic disease cases in the next few years. That's all from me. Thank you.